So I'll just give a quick introduction to all of you. Prachi has completed her nursing degree from Australia. And yes, Prachi, if you can introduce yourself, which university and much more about it, of course, the students will be very happy to hear from you.
Yes, I'll be happy to share as well. So I did pharmacy in India, and then I came here with this course, graduate entry. So I only had to do 2 years of nursing instead of three, and for that I had to do 1 6 week of course and give an exam and then pass it, and then I just have to do 2 years later on. And then after doing that we need to give PT or IELTS and get 7 bands each, and then we get our registration and then we can apply for jobs. With jobs they also provide graduate entry, sorry, a new grad course so for students, and then they'll give you jobs before you get your registration. So yeah.
All right. We have one more panelist as Mithul. He has just joined us. He's just joining us.
Hi, everyone.
Hi, Mithul. How are you doing?
Not bad, not bad.
Yes, fantastic. So yes, everyone, Mithul has also completed his nursing from Western Sydney University. He would
That's
like
right.
to introduce, just introduce yourself, Mithul, regarding your study, which degree you completed, which year, and which university.
Hi, everyone. My name is Midul. I've just recently completed my degree in nursing, which is Bachelor's of Nursing from Western Sydney University. And I have received my registration a couple of weeks ago.
Thank you so much. Just we quickly go down to the questions. There are so many questions coming up from the students. So in Australia, what are the tuition fees for Masters of Nursing? Chaitanya is asking, the fees vary from university to university. I can give you a range of the fees, Chaitanya, which is approximately $30,000 to $42,000 per annum. We have one more question. Okay. How was the experience while studying Bachelor's of Nursing in Australia? So I guess one by one, both of you can answer, Mithul and Prachi, about your experience of studying nursing in Australia.
Mithul, do you want to go first?
Yeah, well, my experience studying Bachelor's of Nursing was a smooth journey, I would say, at first when they said that it's gonna be difficult. I think English proficiency, that's the main part, I would say. If that's the area, if you're doing well, then I think sort of rest of the degree would be smooth. And yes, it's a good experience, and it leads to a rewarding career. So yeah, I think it was a good experience for me.
So what all subjects you studied during Bachelor's of Nursing, Mithul?
We had a range of subjects, starting all the way from mental health to some of the management subjects, some of the pharmacology subjects. So yeah, there were a range of subjects. I think I've also done foundations leading to bachelor's. So I had more sort of subjects than what was offered in bachelor's. So I did altogether 8 every year for 4 years. So yeah, it was way around 20 subjects. Yes.
Prachi, yes, if you can just explain about your experiences and all.
Yeah, my experience was good. It was totally different from Mithul because he had to do 4 years. I had to just do 2 years. Subjects were quite similar for last 2 years, but we had human anatomy, then different, like he said, mental health, management, and few more for graduate entry because it was with graduate entry there was like all the subjects which he did for first 2 years. I had to do it in 6 weeks, but it's easy and they help us. And with exams it's totally different from India. It's all MCQ based, and then 50% is assessments. So those are like bit tricky one. It's more of practical knowledge and how you do your assessment. Like he said, you mentioned about your how your English is, and then yeah, so that helps.
I think English proficiency is one of the
Yeah,
core things that
well,
you have to do when you come into nursing, because in Australia it's sort of more about things to be recorded and documented. And even though if you're not that hands-on, but everything should be recorded and documented in a way where you can convey everything in its entirety. So your English plays a very important role. And even in order to get your registration, you have to again opt for your English exam, which can be IELTS or PT or whatever it is. But yeah, so English plays a very important role, I should say.
With proficiency as well as how you frame like assessment with your proficiency, I think because there's no certain thing which they give you that it is gonna come from this much, but you have to frame it in like 1,000 words. So that is why important that how much content you get, and even plagiarism and a lot of other things. So but that you learn, and then they help you in uni as well. There are a lot of they have this kind of sessions where you can just go and they help you how to do your assessments. So yeah.
That's right. If you opt for a university like Western Sydney and some of the other good ones, yeah, there's always help available, especially for international students when it comes to getting acquainted with their ways, so to say, because most of our attendees today might have done their bachelor's in India. So yeah, if you want to get familiar and acquainted with Australian studies, yeah, opt for better universities, which some of our panelists or management can recommend you. But yeah, there is always help available.
So if we can both of you give a brief, a very quick background. What did you study in India, and how did you opt for bachelor's of nursing? Or Rachi, what was the education in India, and how did you go here with Western Sydney? If you can just give a quick brief on the background of yourself.
Yeah. So I've done pharmacy. I've done bachelor's in pharmacy. That's why I just had to do 2 years here, and I got that graduate entry course. So once you've done any degree in India in health related field, it's gonna be very easy. You just don't have to worry. And I was honestly going just 1 day a week, which was for practical, and for theory, I wasn't attending any of the lectures. I mean, you shouldn't be doing that, but I was doing that, and still it was manageable. And with Western Sydney University, it's like they have lots of campus and lots of students studying. So they have Facebook and WhatsApp groups, and they just share everything, notes and everything. And like it's very easy to crack like exams and assessments. It's okay if you don't attend the lecture because people just post it anyway.
So how easy for what with you it was to change your stream, like just a little subjects, but it's a huge difference between a pharmacy and a nursing background. Why did you choose and what benefits did you get after pharmacy and then choosing nursing degree?
Honestly, it was different. At first I didn't want to take, and I had discussions with you back and forth that I want to go for pharmacy, but again, to get PR in nursing is way easier than pharmacy and jobs. So after nursing, there's never a day where you don't get job. Like you always have jobs. I'm doing 2 jobs right now. Even Mitul's doing 2 jobs. So it's you always like once you finish your nursing, you'll straight away get job. And then yeah, I'm sorry, I'm just getting a call. Yeah, can you hear me?
Yeah, we can.
Yeah, so that is easier than pharmacy. After doing pharmacy, I think it's really hard to get jobs here. And yeah, so at first I was thinking like in India, how people think that with nursing, when you go, it's just jobs in hospitals, but it's completely different here. I've not worked in hospital. I've worked in mental health where I was able to give counseling to people, do their assessment and intake. Then I have worked in a cosmetic clinic where I can inject as injector. So it is allowed here. It's not allowed in India, but here nurses can inject. So I'm working part-time in a clinic where I can do Botox, fillers. And also the other job which I'm doing it's in a COVID clinic. So where we test people, and then even we can do blood test. That's why they have RN. And yeah, and then I just got promoted as a supervisor there. So it was a different experience.
Thank you for that. And Mitul, what did you complete in India?
Well, I just finished my higher education, which is my last 12th standard. from Gujarat, and I just straight away make my move here from foundation leading to bachelor. So I didn't do any degree back home. It was my first university experience, and it was in Australia. Yes, I didn't finish any degree back home. Yes. So for me, there is not much of comparison that I can make from here back in India because I never went to uni in India. So.
All right, thank you for that. We have a question from a student. I'm planning to do my bachelor's in Australia. I have done +2 in BPC in India. Okay. Yes, Richard, we can help you to make your applications to the degree in Australia, what you're looking for. Which program you're looking for, please mention the details so we can help you to connect that also. So Richard is looking for nursing itself. Yes, so you can apply for nursing program after +2. The same way Mitul replied that he completed his +2 and then he went to foundation program leading to Bachelor's of Nursing to Western Sydney University. However, the intakes of nursing, as some student has asked me, there are very few intakes in Australia. There are 2 intakes which we can apply in Feb and July. The ideal intake with all the universities February for nursing, and the deadline of the application closes really fast. So we need to make application as soon as possible if you're looking for Feb 2023 intake. We have one more question from a username. I have completed Bachelor's of Science in Biochemistry and want to do my Master's in Laboratory Science. Yes, we can apply to many universities. RMIT is a very good university when you apply for Laboratory Science program. I'll just read out a few other questions.
Priyanka, just before we start the more questions, can you share the Google form as well so that the students will fill it?
I'm just sharing a link of a Google form. I request all the students to just fill the Google form quickly. So we can go to the next question. So Myra has a question. As an international student, did you find it difficult to interact with the professors? So what do you feel, Prachi?
No, I don't think so. There was any hesitation or difficulties talking to with any of the professor. I think with accent you might just get, for few words, like you might just get confused, but you get used to it. That won't be a problem. Because obviously, if you're able to get that score in your IELTS, you'll definitely be able to communicate.
So were you able to communicate with them?
Yeah, there wasn't
Were they
any problem.
easily accessible for the questions and all?
Oh yeah, they were really good. Honestly, yeah. So they were there always. They used to, even after lecture, if you go to them and then you ask anything, they were really helpful. And then they have this, you just have to email them. They'll always reply. And then there's a coordinator, so you can always email them. And then they also give you timings where you can just go and see them one-on-one. And yeah, so they were really good.
It was really easy and you were comfortable enough to interact with the professors in the university.
Yeah.
Yeah. How was the experience, Mitul, for the interactions with the professors at the university?
I think yes and no, because I think even some of our attendees who attended the universities in India, like you will have professors where you feel more, I would say, easy to interact, and there would some where you don't feel much. So it's again a person-to-person thing. But I would say at Western Sydney University, the staff is very professional. And as Prachi just mentioned, that even if you don't feel okay to sort of ask questions in front of the class or the lecture itself, there's always ways to interact them through email. And there's also this program, I forgot the name, but it's like a student and a lecturer program where it might not be the lecturer themselves, but there's always someone from that faculty whose responsibility is just to sort of answer questions or doubts or even questions regarding assignments after the lecture. There are different portals of email, and even as Prachi mentioned before, that there are also different timings allocated where you can go and see them one-on-one. So I think, yes, there shouldn't be a problem. There are always multiple people to ask. There's not always sort of one person and one window thing. No, I think there are, even with one subject, there are multiple people you can ask, and there's always, as I mentioned, help available. So yeah.
So I think it is just more of our hesitation, the students' hesitation of asking the questions to the faculties. But
Yeah.
then it is better to keep asking all the time to your professors, to your classmates. They are really friendly, what we have heard from the last session also. It is very easy to interact with the students there also.
And yes, there are a whole lot of international students, I would say. Even in the class, there are at least 50% from all kinds of backgrounds and all kinds of countries. And everyone sort of know what situation is. Everyone like things like they're in the same boat. So I think pretty much everyone was very cooperative and easy to interact.
And I think students are really helpful to each other. And even during exams, I can say, so they used to place us in like classrooms with same last name, and then I could find literally the whole class with my last name. Yeah, so it was really comfortable and easy.
That's all right. Coming back to a question from Chaitanya, how good is the accommodation and what kind of facilities do the students generally avail? Yes, Prachi.
Yeah, so there's a accommodation facility available in uni as well. So for someone who doesn't have anyone here, I'd recommend just stay there for some time, and then you can make friends and find accommodation outside. But if you got friends whom you can share the apartment with, it's really nice, and then you can just find around near to your university. It depends, again, it has a range from and again, with how you're sharing the room, or you're not sharing, you're sharing the apartment or living by yourself. So it totally depends what kind of accommodation and suburb you want to live in.
And at the university, the students get all the facilities. You have a Wi-Fi zone, you have a coffee place, you have your own library in the accommodation, which is offered by the university. And of course, you have a computer lab also, which is 24 hours, 24/7 accessible by the students.
Yeah, and they
It's very
won't
secure. You
provide
can go to, yeah, yes, Prachi.
Yes, they won't provide food. Like, I remember a lot of time me and Mitul used to go and do our assessment, and they'll just come and just offer us a lot of food. And that has happened so many times, like even in the evening. So uni is open all day. You can go anytime. You just need your ID card, and you can just sit there, lounges and everything, and you can just chill, and then you can study, and they even offer you food for free. even even the morning, you can just go and do your breakfast there.
So in that sense, there are a lot of youth groups and other organizations sort of working with uni, and there are some international groups. Some of them are backed up with the community and the cultural groups. There is also Indian Student Society there that also runs their own stalls different times during the day, and maybe I would say multiple times during the week as well. So if you just happen to find them, just go and have a chat with them, and that will make you feel more like you have a community there. And I should say, a university like Western Sydney, yes, you will have a whole lot of students from that subcontinent of Asia, because there'll be a whole lot of Bangladeshi students, Sri Lankan students, Indian students, Pakistani, and yeah. So yeah, there won't be a problem such, I would say. And yeah, regarding the accommodation, I think it's the pretty easy answer to that is that it depends upon your affordability. Like if you pay more, you get better accommodation. If you pay less, you get that kind of accommodation. So yeah.
And as you were talking about the student ID card, so how did you get the student ID card, and how was your first day at the university? Both of you, it's very important to understand that experience.
So with that, it was really good. So once you go, you just have to check in, and then they'll guide you from there. First day is just like they're gonna show you whole uni, so that way you get used to it. They're gonna do a tour of the uni. They'll take you, and then it's very easy with ID card. You just have to go. You have to give the number. I think your enrollment number, which you get on I think, ma'am, you provided me that before I came here, and then that's it. You just need that password and ID, and they'll just give you straight away ID card and whatever was required. It was so easy. Like, I don't see any yeah, I just don't remember if I had any troubles or issues. It was really easy. So once you go in, they are just going to help you with everything.
So that the student ID, when you make an application to the university, then offer is issued, which holds a student ID, which is of yourself. And with that, you can get an ID card issued by the university once you reach there. Is that so?
Yeah, no, so we just have to give our number. So I think you just gave me that.
I guess the student number. Yeah, yeah.
Yeah, so I just went there, gave it, and I had to show my ID. So initially, I was just using my passport, and
Yeah.
that's what I gave them. They straight away clicked my picture and gave me my ID. So very easy.
That's good. And how many hours you used to study at the university during your during a nursing program?
Yeah, so like I said, I was not going to uni that much, but during exams, yes, I think me and Mitu, we used to just go and then study in the evening, because obviously we used to work in the morning. So around 4 or 5 we used to go, and then we used to stay there till 10, and then yeah.
Oh, okay. And how about you, Mitul?
Yeah, well, during the week, I think the study hours that I used to allocate during the whole week was close to 6 hours, maybe. But yeah, when there is a sort of exam, you're under pressure, and then you will go university frequent. Maybe I would say, if I can recollect, during exam week, we used to study more, but during the normal weeks, it would be even hardly study a couple of hours. Mostly we would be working. But yes, university, the university that we graduated from had a whole lot of campuses where we live here in Parramatta in Sydney. So yeah, the environment there is sort of welcoming. So you even go and feel like studying there. So yeah, during exams we was there for more hours, but during the week, during the normal weeks, I won't say we were studying a lot. No.
So okay, there's a questions. So how did you get your transportation done while being in Sydney? How do you used to travel to the university?
It's pretty easy if you're living here in Sydney. Buses, trains, and everything's on Google Maps, so you know what time's the next bus coming, and trains are very frequent. And for uni, let's say, so if you're studying in Parramatta campus, so one campus is just next to the station, but if the other one's really far, the uni itself has buses, and then that's free. So you can just catch it from the station. They'll take you to the uni, and from uni, they'll take you back to the station.
Like, it's a shuttle service from uni for all the students, because they do know that a whole lot of them are using public transport. So if you are in an area, or if you choose a campus like Parramatta, yes, you will have a shuttle service, which makes it very easy. And they're very frequent too.
Right, that's good. We have a question from Chaitanya again. How difficult or easy it is to find a on-campus or off-campus part-time jobs during your first semester or year of your study? So how did you find your part-time jobs, Mitul?
Part-time jobs. So throughout this 4 years of mine in Australia, and this is my 5th year, so I went through a different kind of jobs throughout these 4 years. So first job I had was at the petrol station, but I had my family contacts here, so I got that pretty easy. And then from then on, I would say one of the other important things in Australia is to communicate and make contacts while you go. It comes in handy a lot. Like, even if you're working a menial job at a McDonald's or a Pizza Hut, just contacts help you in the long run. So yeah, I first started at the petrol station, followed by Pizza Hut. Then I got my own field job as an assistant in nursing at an aged care. That too was referenced to me by one of the students from uni. And then yes, since then I've been working with that company. So I think it's more about you know, I have known a whole lot of students here in Australia who didn't have that kind of contact, but what they did was made their resume, make 50 copies of it, and just hand it over to all the shops by themselves, like door to door. So I have seen people using different kind of strategies to get a job. I think at this point it is easy to get a job after COVID-19 and after the lockdowns. I think there are more jobs available. But yeah, I haven't heard anyone who never had a job in Sydney after coming. Maybe 3-4 months max, and you will have some or the other kind of job. It's just about your own readiness.
Right. And how about you, Prachi?
Me too. I just had family, so I was working with them. But I've seen my friends. So what you can do on Facebook, there's this apps called Gumtree. They just apply through them, and then there are people like Inins. Even with part time, you're allowed to do 20 hours. But if someone wants to do above that, they can just do it in cash. And then there are a lot of Indians advertising that they want people to work on cash in hand jobs, and then they'll just write it. And if you're interested, you can just call them. So there are like heaps of jobs available, and it's easy to get.
Again, as I
All
said, it's about how eager you are. But if you just like, you have to work for it. I would say you have to go around, communicate, and stuff like that. And even you can, as Prachi mentioned, there's a whole lot of advertisements available online.
So yes, part-time jobs are available now after COVID. When we talk about, they're really easy to get in. Yeah, yeah. All
Yeah.
right. Question from a student named Sandeep. What are the challenges did you face while you were studying? So what was your experience? Challenges, if you have any challenges, or if you just share your experience during your studies in the university?
Like I said, keeping up with assessments because they are totally different. Like I said, so let's say there's a topic called diabetes, and you have to write something in 1,000 words. But diabetes is like, if you go and search, there's like thesis and thesis available. So you don't know what to frame and what to write in just 1,000 words. And I've faced few times where I've written something and I just end up like getting really less score, but then I had to cover up in exams just because I failed assessment. So yeah, those were the challenges I faced, but you gradually you learn. But that was during my initial semester.
All right. Thank you for answering that question. However, what is the experience after nursing program? How could you find jobs there? How did you do your registrations as a nurse?
Um, with registration, it's easy. You just have to do one police check, which is online. Um, you need that's it, and then you can just apply. You need to obviously get 7 bands each in PT, which won't be a problem because after studying 2 years here, it will be easier for you. And that's it. You just have to submit your score, your details, where you studied, where you lived, and your police clearance, and then you'll be able to get it. So it's not a big task, and you just have to wait 6 weeks after you apply, and then you'll get it. And with jobs, again, there are like apps which I use, Indeed, Seek, and you can just put your resume in there. They'll contact you. You can contact them, even LinkedIn, and then it's easier.
So it's really easy to get jobs there from the job portals.
Yes, it's very easy.
Yeah, yeah. Mitul, what is your experience about this?
Getting a job or accepting an offer from job portal is the way in Australia to. I think it's sort of a mainstream way to apply and find jobs. So yes, that's the most effective way. And again, for me, I didn't do much of Seek and Indeed applying, but because the places that I was working, I tend to stick with them. The companies that I'm working with, I'm on my 4th year with them now, and they kind of promoted me after I got my degree. So yes, even if you start with a good organization from I would say from much earlier, then I would say there's always opportunities. And some profession, like especially registered nurse, or someone just mentioned about pathology, I think those profession always have some or the other opportunities handy.
So how did you clear your registrations? I just wanted to clear these doubts for the students because they really have to know, I want to understand, do you have to sit for a paper test or an online test to go for a registration?
Okay, so this is how it goes. First, you obtain your degree, and they will, after you finish all the units with whatever score the requirement is, they'll provide you with a completion letter. So you take completion letter and go to the organization, which is called AHPRA, AHPRA. That's the agency that provides registration for all the nurses, paramedics, and different profession in health and care, health and welfare. So first you do your completion letter, which is finishing your degree. Then second part comes, as Prachi mentioned before, the police check, which is very easy. All you have to do is apply it online, pay the money, maybe 30, $35, and then you receive it within the week. And the third and the most important, I would say, is the PTE and acquiring the score that they require, which is a 7 bands in each module in IELTS, or if you do PTE, more than 65 for each module. And the one good thing about it is, especially just for nursing, you can sort of use two different, like you can have two sittings of the exam. Like, for example, if you sit for an IELTS exam first and only manage to get a 7 band score in first 2 units, then what you can do only for registration is that you can sit for another exam and try to get 7 bands for other units that you missed out previously. And you can always use those both mark sheets and still it is valid and accepted. So that's the last step with the registration with APRA. And you will receive your registration. Right now, the waiting period is 4 to 6 weeks. So yes, that's the whole process. There is no sitting down and giving an external exam or anything like that. But once you have your degree, this is the process. I think it's not a very difficult or complicated process.
Thank you so much for clarifying on this, Mithul. There's a question from a student. What are the advantages of career placement services at the universities? So did you have any career placement options or recruitment cell at the university?
Yeah, I think I can see where the question is coming from, because in India, for most of the universities and degrees, I've heard that organizations and institutions come down to the university for interviews and placements. But for nursing, I haven't heard anything like that so far. That if organization or hospitals or them come down to university, but for nursing, we have a new grad program. That's what we call in Australia. So when you reach your third year, and I would say first semester, at the end of first semester of your third year, which is the last year of nursing, there is something called a new grad application program, which is offered by NSW Health, which is the government agency. So it's again all online. You apply for a new grad program. It's again not a difficult process, but a thorough process where you fill in all the details, provide with the documents, and they do ask for mark sheet. I'm not sure. So you apply for that in a new grad program, but for international students, it's not very popular, because in new grad programs, they sort of always choose the local students first, the domestic students, and then in order to fill the last places that are available, they might go for international students. But it is a good experience. I think everyone should opt for a new grad program so that you can have experience how things are when it comes to hiring and pursuing the career in the workplace. And then again, moving further from there, if you don't secure a spot when you are in new grad program, then you can go to Indeed and Seek and look for advertisements, opt for interview. But yes, I don't see any organization or institution affiliated with uni, because when it comes to job readiness and acquiring a position in after you finish your bachelor's, I think with nursing and all health and welfare um, profession, it's the government and it's the NSW Health that sort of runs all the program. Because in Australia, nursing is a profession where you're required to register. So most of the profession is kind of inspected and is under watch by government. So yes, you do your academics from uni, but when it comes to acquiring a position, I think it's again new grad program, or if not there, then you can go to Indeed or Seek or any online.
All right, all right. But do the professors recommend any jobs available in the hospitals or XYZ place in the healthcare center?
As I said, it's again, it's not more about the staff recommending you, because even their recommendation or anything like that won't work, but they can always reference you. Like if you if you are successful in clearing the interview with a hospital, let's say, or an organization or an age
Or
care.
as in then any availability or an jobs availability in the specific hospital. So is there any support from them?
What kind of support?
Just to inform, see, for example, currently you're working with an hospital or an old age healthcare center,
Mhm.
and if there are jobs available there, how do you come to know about it? Except the job portals.
The job portals, I guess the job
Yeah.
portals. Right.
Okay, okay. Right, right. Okay.
Because there is not much like I won't say it's from the word of the mouth that they do their what do you call, they sort of offer the positions. I think in Australia it's all about you accepting, first applying for a job through a portal. It's very professional, and then they look through all the applications and yeah, they shortlist.
Yeah.
People
So
can always recommend, if you work with some institution, they sort of recommend to the HR and you can move on from there. But in order to get in at first, you have to go through the normal process.
yeah, same. So even when you're on your placement, sometimes your the nurses you're working with or senior nurse, they might like you, and they, but still you have to go through the interview, and then they'll tell you that, yeah. With one of my friend, where she was working, the num there, she liked her so much, she said you can apply and go through, sit through the grad entry, and then because the num wanted her, she just selected her, but she had to go through the formal process.
Okay. Okay.
They can always sort of advertise if they know in the department if the positions are available, but everyone has to go through the formal process. And yes,
Yeah.
as Prachi mentioned, a work placement. So you have I'm not sure, 800 hours of work placements. Yes, if I'm not wrong, 800 hours of work placement through 3 years course of Bachelor of Nursing. That's the best time to make contacts and to know how the profession works. And that would be the best time to know how all that process works, whether it be jobs on hand or how to get into a career. Yes, I think everyone should make a lot of use when they are on work placement. They should make a good use of that program.
So just when you're talking about jobs, a vague question. So what are the packages student get over there, or what are the hourly wages during the part-time?
Depends what they're working in. If they're working in restaurant and gas stations, they get around between 25 to 30. But
That's
once they
good.
once they finish nursing, starting pay is 32, which is really good. And then if it's a shift work, I think you get point 0.5 in afternoon, and night shifts you get double, and even on weekends you get double. So yeah, it's
Yeah. So
really good.
you meant $32 per hour?
Yes.
It's sorry to interrupt, but for nursing in Australia, nursing award rate goes like this. For year one, division one RN, it starts with 32. So if you stick to the profession for longer time, your pay rises subsequently. Like when you become a division two or year two RN, it goes to 34, and then year three goes 36, and so on. I think when you reach your year seven or year eight, you can easily secure uh, a a payment around $100,000 annually package. $100,000, yes. But
Yeah.
that's when you year seven or year eight. And again, you can always pursue for masters or graduate certificate, which are offered after your bachelor's, and that can also contribute to that if you're looking for more better financial options or better pay raise. So yes, and again, there are in nursing, it's a vast profession. Like it's not the nurse that you always imagine the one working in hospital. There are different sort of roles. There
Yeah,
are
so exactly
CNCs. Yeah,
out of curiosity, I was about to ask you, Mitul, sorry to interrupt. If you can just
no worries.
explain what exactly nurses can work after completing their degree in Australia. It's only in the hospital, or there are a lot many other places a nurse can work as?
So in Australia, nursing is one of the top 10 professions right now, always making it to top 5, even when it comes to what you get out of the profession, whether it be your pay, whether it be the rewarding career as it is. And I think rather than what you're imagining or thinking right now, that traditional work that you do in hospital, there are always different positions. Like there are management positions, as Prachi mentioned before, someone called NUM, which is nursing unit manager. But that position you can always, you will only manage to get into that position if you have a good amount of experience on your CV, or had a couple of master grad certificates, or maybe a good master program in management. So yes, there is one. There is something called nursing unit manager. It is one of the most senior posts which you can uh, acquire as an RN, but that comes, as I mentioned, that comes with an experience. And there is something called CNS, which is clinical nurse specialist. That also comes with at least 5 years or 4 years of experience. There's something called CNC, which is clinical nurse consultant. So CNC is something which is a nurse who has kind of got a specialty in some of the specific branches, such as, for example, wound management or diabetes CNC and others. So yeah, that's CNC. Then we have a CNE, which is a clinical nurse educator. Again, you have to do an education certificate course or anything equivalent to that in order to pursue that. And again, you will have to have at least 2 or 3 years of experience. All sort of senior positions in nursing career, experience is one of the most important aspect in order to get there. And you should always, our panelists from Storm will also, would say, advise you in that what are the better career options even after bachelor's. And it depends on what kind of grad course or master's specialty that you are doing, and then you can acquire a job role in that field. So yes, it's a vast career. It's not something that we are thinking traditionally.
Yeah, yeah. Anything you would like to add on to Mitul, Prachi?
Yeah, so he just explained you about the positions, but I'd like to say nurses can work in schools to give counseling to students. They can also work, there are a few nurses who so they're like called flying. So when they just travel nurses, they can travel to different countries with the patients. Then there are nurses which have to just go and visit patients at home and just spend time with them. Then you can also work from home, and you just have to call few patients and check on them every day. So there are different it's not just working in hospital. Like I said, you can even work in medical centers. So with doctors, like we have, you have to just give medications, and you can give vaccines, and you can inject. You can work with in a dental clinic as a nurse. So there's a lot of different things you can do. You just don't have to work in hospital being a nurse.
So that is very clear. Thank you so much, Mitul and Prachi, for clarifying that you don't have to only work in the hospital to work as a nurse. You have so many vast options available as nurse also.
Yeah,
Yes,
and
exactly. Sorry, go ahead,
with
Prachi.
mental health, you don't even have to get dressed like a nurse, because obviously mental patients, they don't like to be, they don't want it that they're in hospital or they're in some setting. So the place where they're living, they just also, you can work in drug and alcohol unit or any other places where patients are just in kind of a rehab. So you don't dress up like a nurse, you just wear formals, you just go there, sit, talk with them, and come back. Pretty chill job.
That's right. In Australia, nursing is sort of career which has a very holistic approach to its core. So you have to make patients or clients in some of the industry, as they say, welcoming in order to accept the services, because as we all know that healthcare is under Medicare program in Australia, which is provided by government for free. So I would put it in a vague sense and say that people kind of take it for granted. So you have to make it look welcoming. So in order for people to come down and make use of those services. So yes, it is a very holistic approach. So it is not dressing up in certain way or talk in certain way, or you have to kind of bow down to doctors or anything like that. No, it's not like that. It's very casual.
Right. There's a question from a student again. Does your average week look like for you?
It depends. Even when you asked about salary, so when I joined this job, my initial package was 60K a year. But if you are willing to work more, like we went lockdown for a few months, and obviously I didn't want to stay at home, so I kept on working overtime and even on weekends. You can actually take it up to 100K even as a first year nurse. So yeah, it depends what you want to do. Just want to work 5 days. Even you can get, as a nurse, you can get 9 to 5 job. Where I initially started as a mental health intake and assessment clinician. So it was just like a clinic where you just dress up, go see patient, talk to them, come back 9 to 5, and then you take weekends off. But then during lockdown, I joined a COVID clinic where I was offered 13 hours shifts and even weekend pay and everything. So yeah, depends what you want to choose and how much you want to work.
And how about you, Mitul? How does your week look like?
Work-life balance is very important. As Prachi said, that there would be times where you will get very tempted. But if you are looking to that six-figure annually, then yes, you will find yourself working 7 days a week, 8 hours a day. So yes, I'll pretty much go with that. Yeah.
All right. And how about the living expenses? Because you are being in the most expensive city of Australia, Sydney, right? So what do you think? How are the living expenses in Sydney compared to other cities? How do you feel it is expensive, or how do you feel living in Sydney?
Well, living in a city like Sydney always comes with a price. So I would say that if you're in a career like nursing, it won't be such a problem. But yes, if you are looking to get a property very quickly once you have your PR, or if you're looking to have if you are looking to have more financial approach towards your career, then I would recommend people to move to regional as soon as they got their graduate or a bachelor's a degree. And that way I've seen from numerous people around me and their experiences that way you can reach to that goal of yours, having a big house or a nice car, a very much more easily and quickly as compared to living in a city like Sydney. But again, if you like to live in a metro city and having a lifestyle here, then as I mentioned before, it always comes with a price. So yeah. But I would say if you stick to the career like this for 10 years, you will make a good rewarding career and lifestyle out of it. Yes. No matter where you are in metro or in regional.
Okay, that's the same for Prachi as well.
Yeah. So exactly it depends how much you're working or what your expenses are and how much you're trying to save. Like, let's say with food, if you're trying to cook at home and pack your lunch, it's easier. But if you're buying food outside every day, or you're getting takeaway, or you're just getting Uber Eats, then yeah, it's expensive. So it totally depends.
So how was the food? Did you get any difference? Did you find your own Indian food there? Was it easy?
Yeah, very easy. You find everything here, literally. Especially where Mithun
And
lives. You get everything. You can just go in the morning, and how you get like tea and samosa and all the Gujarati dish, you can just find everything there.
okay, that's really good. So you don't
Yeah.
feel like home.
Yeah,
Yes.
actually. And then even you get poha, like how we get in Ahmedabad, it's just exactly like that.
And
because
did you get any difference in culture shock? Yes, Mitul. Sorry, you were saying something.
yeah, I would say in Sydney there are a whole lot of people from that subcontinent of Southern Asia, and you won't in some areas if you go, you won't even feel like you're in Sydney. Like you won't be able to make a difference there. So yes, there's a whole lot of exposure, and you won't have a culture shock. Let me tell you that. Well, in some sort of areas where you go, you might feel like you're in Australia, but in other areas, you won't even feel a difference. And even climate plays a very important role. Climate is much similar to India, I would say.
And how was the culture difference? Did you get any cultural shock there?
Yeah.
Not
Did you,
not for
Prachi?
Prachi,
Yeah,
my
that how everything just closes at 6. So after 6,
Oh,
you can't find any shops open. But yeah, again, if you're going to that Indian suburb, everything's open late night. So yeah, it was okay.
yeah, that's where I'm
So
residing at the moment. So for me,
yeah,
it was not much of a culture shock. So yeah.
yeah. So if you visit that area, even at night, there are like people sitting outside, and then there's pani puri stalls outside on the road and everything.
okay.
Yeah.
And yeah, please tell me.
Ah, no, that's it.
And how about the a very key point which has just come up to my mind now? I really want both of you to answer that very briefly. What is the difference when you feel studying, because you already have studied a bachelor degree in India, Prachi? How do you feel a difference studying bachelor's or any subjects or degree in India and compared to Australia? What are the difference between, as we talk more about practical learning based, there are no theoretical and more of practical and assignment based studies in Australia. So how was your experience with that?
It's actually more fun here than India, and it's not like burdensome because in India, like how you have to go every day to uni, you have to spend long hours there. But here it's different. You just go one day and it's fun, more practical. They make you do things, write on board, make groups, you can discuss, you play games. That's how they actually teach you. You have to find yourself some, they'll give you a few questions, you have to find yourself answers, go write it, study. So it's actually different. They make you do quiz, and with practicals you have practical lab where there are mannequins, and then you just have to, they're like some of them are made just like a human body. So they even you can just check their heartbeats, everything. And then even in hospital when you go on your placements, they let you do everything most of the time. um Obviously you're under supervision of an RN, but they let you do things, not just studying. And yeah.
So it's all hands on, not touching the patient, but yeah, you can can you prescribe them medicines and all?
No, we can't prescribe, but we can give them.
Okay.
Even in, so it depends. If you're doing, if you're on your first year placement, all you can do is check BP, and all sort of things. But when you're in your third year, they actually let you give them IVs, and they let you give them all the medications and do their wounds, everything. But just there should be another RN standing next to you. That's it.
And how about you, Mitul? What do you really feel? What is a practical studies or learning means in Australia?
I would say throughout the nursing degree, the most you learn is what you learn on your placements, which is 800 hours throughout 3 years. In uni, you sort of learn much limited, but I would say the university that me and Prachi went in is it's one of the best here. So they have a whole lot of high tech, different high tech, what do you say, appliances, and as Prachi mentioned, something called something which is called a mannequin, which is a robot. It's basically a robot, and it will, sort of, you can program it for someone who's suffering from, let's say, COPD, and then it will react like that, and then assessor will assess you on kind of clinical judgments you are making, or medication you're administering. So yeah, in that way it was something which was very out of the world when we came down here and studied that in this university. And again jump down back to what I was saying about work placements. That's the part where you learn the most. So I would recommend everyone and advise everyone to make the most out of it. So yes, it's pretty much hands-on here rather than theoretical. But yes, as I was mentioning in the beginning, that English proficiency is very important, and documentation is, I would say, the most important part when it comes to nursing. I would say it takes the 50% load of actual career. Like when you're a nurse, you would find yourself doing documentation 50 to 60% of time. So, because it's more about what do you document and what's on the book rather than what you do more hands-on. I would put it that way in a vague sense, but yes, that's what it is when it comes to the profession in brief.
So, just out of curiosity, will you more recommend your family members to come to Australia and study?
Yes, I would, for sure. I think I would rather recommend my family members to come down to Australia and countries like New Zealand rather than Canada or further west.
Right. Canada is a bit cold, isn't
It is
it?
cold, and
Yeah.
it is cold, and that's what limits a whole lot of opportunities that you can have. Though it's easy PR, but yes, it comes again with that climate problem.
Did you find Australians? Are they friendly with you, or do you find did you ever face any difficulty in talking to them, or did you face any kind of negative or unfriendliness from them?
I won't say that. No, in a general sense, they are much considerate and friendly. But again, like as I was mentioning before, that it's people to people. You might have people who are not that up to the mark or your expectation. But again, I would say in general sense, my review is 5 stars. Like everyone's pretty friendly and chill here.
How safe is Sydney when you talk about safety features of see India? We know Gujarat is the very safe place, and you both have been from Gujarat. How safe is Sydney in that case?
Depends on suburbs. So if you choose to live in this suburbs which there are a lot of Indians, it's very good because I live by myself. It's actually safe. Sometimes I have to go to work 5 in the morning and come back at night. But yeah, so if you're living in western suburbs where there are a lot of Indians, it's better. There are a few suburbs where I would say not too safe to travel alone. But so yeah, you should just always stick to where other people are.
Yeah, statistically speaking, I think compared to a whole lot of different countries that all international students are pursuing, Australia is one of the safest country, I would say. And as Prachi mentioned, yes, if you're living in suburbs where you have people from Indian subcontinent, you will feel more safe there. But coming from someone like me, when I came to Australia, I went to somewhere which was bit regional, but again, there was very less exposure from people from Indian subcontinent or Asians as much. But I never felt unsafe in that sense. But again, when it comes to females, there might be different views. But yes, I would say statistically, it's much safer than other countries that international students are normally pursue.
That's good. Thank you so much for sharing your views on the safety things in Australia. Anything else you would like to share your experiences? Where I guess we have students have asked a lot many questions, and I've tried to cover a few other rest also. Anything which you really want to inform the students? You like to share experiences, Prachi and Mithul?
Um, I think if you have any hesitations, still you should just take the step and come and not just like yeah, you should just come because when I was planning, I had like few hesitations. Why should I just go? It's a different experience. What am I going to do? But yeah, you should still come and explore, and you'll feel wonderful once you are independent, and it's just a different experience.
Right. Yes. Because you did your bachelor's in a different field and you're changing your field to nursing and you're not confident enough. Will you be able to study
Yeah.
that? Will that program will interest you?
Yeah. So just don't limit yourself. Explore. And yeah, I had few, even like leaving my immediate family behind. I came here, I had family. I had Mitul, like my cousins. Nidhi was here, but then yeah, it's just still if you're not confident, still just take the step. Don't limit yourself and explore. It's a wonderful experience, and once you're independent, earning, it just feels really good.
Thank you so much for that, Prachi. Would you like to say something, Mitul, before we close up?
I would say yes. It's not all rainbows in spring here. It is difficult, and it is not for someone who is looking for comfort. It all comes with price, as I kept mentioning before as well. There is hard work. There is kind of studies which are much different from India, but I would say it's all worth it. It's worth coming here. It all come because all that aspects that I just mentioned leads you further to independence, better career opportunities, and all in all, developing yourself. So I would say it's worth coming and worth taking those challenges.
Oh, yes, yes. That completely agree on that point, Mitul. All right. We do not have any more questions with the same thing. We have tried to cover everything. Thank you so much, Mithula and Prachi, for joining us today and talking to our students, solving their questions about nursing and other courses. For the students, you can just all download our app and you can chat with the alumni about board discussions on the programs. Thank you, everyone. Thank you. Have a good day. Thanks, Prachi. Bye. Bye. Thank
Thank
you.
you.
Bye, Mithul. Thanks.
Thanks.
Bye.
Thanks for
Yeah.
having
Bye
us. Thank you. Bye.
Same here.
bye.
Bye.